Hi, my name's Tom Bartram. I'm an A&E consultant here at Macclesfield Hospital in East Cheshire. Last winter was the busiest ever for healthcare, and there's no reason to think this year will be any easier. At Macclesfield Hospital we admit 30 patients a day, and this year there are already days when this is a challenge. Good flow is the effective and timely movement of patients between departments within the hospital, and it's key to patient experience, clinical safety and reducing pressure on staff. When flow slows down, the system clogs up and patients wait. This isn't how any of us would want our families or our loved ones to be cared for. Helping flow should matter to all of us, because if we get it right, our patients benefit, our staff will benefit, and we'll be in a much better position as we approach this winter. Helping flow, here's how. Whatever your role, wherever you work, we all have a responsibility to make a difference to flow.
I'm helping flow by working with other care providers to ensure that we have the necessary staff and resources to care for our local population.
I'm helping flow by working with my community team to keep our patients well at home and keep them out of hospital.
I'm helping flow by ensuring that I'm aware of alternatives to A&E when a patient doesn't require emergency care.
I'm helping flow by providing information to the hospital when patients are admitted.
I'm helping flow by getting patients where they need to be as quickly as possible.
We're helping flow by transferring patients from their ward to the discharge lounge.
I'm helping flow by caring for people in the community who are medically well but not ready to be completely independent.
I'm helping flow by working in conjunction with my colleagues to ensure that a robust, holistic and safe approach is provided for all.
We must start to plan a patient's discharge as soon as they are admitted.
So checking a patient's community care arrangements whilst they are being assessed can help us to make a decision about whether admission is the best or only option. We're helping flow.
All patients have an expected date of discharge generated on admission. If we identify at this stage whether the patient will need transport and book in advance via the discharge lounge, there's no more waiting for transport. We're helping flow.
So often patients have to wait for their EDNF to be completed when they are otherwise ready to go home. Let's make sure EDNFs are started on admission and updated throughout a patient's stay. Then, waiting for discharge meds becomes a thing of the past. We're helping flow.
Doing your job today will mean patients spend less time waiting for things to happen while they're in hospital.
The morning board round on ward is key to planning what needs to happen each day. We need our doctors, nurses, therapists, pharmacists and ID team members here.
We use red and green to help us. A green day is a day where patients are actively receiving acute care that can only be provided in hospital. A red day is a day of waiting or inactivity.
If people are missing from the board round or we're not specific about what needs to happen, how do we know we're working towards the same goal? A well-attended and action-focused board round is helping flow.
We must involve patients and their families in discharge plans to ensure that they all have the relevant information and all practical arrangements are in place.
If we talk to patients and their families about our expectations for discharge, we can avoid some of the last-minute problems. Ask yourself, does my patient know the answer to these 4 questions? They really should. When patients and families are involved in planning their own discharge, that's helping flow.
If we encourage patients to get up, dressed and active, it will help to maintain a patient's functional fitness.
This starts at the front door in our A&E department. Ask yourself, does your patient need to be on a trolley? Do they need to be in a gown? Or are they fit to sit?
Being in your pyjamas and in bed when it's not clinically necessary can contribute to some really poor outcomes for patients. Ask patients and their families to bring in suitable clothes and footwear to keep patients active where we can. We need to give patients the opportunity to get up and dressed when they are willing and well enough. That's helping flow.
These are just some of the ways we can help flow. We can make this winter better for all of us. If we're helping flow, we're helping each other and we're helping our patients.